Good morning, ladies and gentlemen. I think we're ready to start. It's now 11 o'clock. I know people might still be coming in. I see there are a couple of people still in the lobby. I'd like to welcome all our clients, our guests, and our NMG staff from across the country. Today we are broadcasting to people across the country. We should have close to 300 people who are joining us virtually. And I welcome you all. I haven't met many of you. So just by way of introduction, my name is Gary Feldman, and I head up the Healthcare Consulting Business Unit for NMG. 2021 has been a different year for all of us. We've experienced 2 additional waves of COVID. We've traveled limitedly. Some people have ups, some people have downs, lost family and friends. But during this time, life has to carry on, business has to carry on. And within NMG, although we haven't been able to visit you face-to-face, we've been trying to stay in touch virtually as much as possible. We've also embarked on a lot of innovation, tried to develop tools and educational ways of not only assisting you as corporate decision makers, but also to educate members. And we'd like to share some of those innovations with you today. But I think the most important point today is to share with you Discovery 2022. I think most of you have heard and received our initial communication around the increases. And we're here today to share some of that detail with you. To try and make today as engaging as possible, please feel free to post your questions in the Q&A. We'll try and answer as many of them as possible, but due to time constraints, if we don't get to your question, please address it to your consultant, your NMG healthcare consultant, and they will then revert with the questions and answers to you as soon as possible. As far as the agenda this morning is concerned, I'm going to be introducing you to Deon Kotze in a minute, who will take us through the 2022 changes. I will then come back and do just an industry overview and address 1 or 2 points that I think are important for you as key decision makers to consider. And then we're going to go into some of the innovative tools and educational products that we have launched and will be launching to you and to your staff in the near future. And then I will come back and just do a bit around the year-end support and what we will be doing for you and your members in the next 6 weeks until the end of November, before we all take a well-deserved break. So ladies and gentlemen, without any further ado, it gives me great pleasure to introduce you to Deon Kotze. Deon is one of the senior actuaries at Discovery and heads up the R&D hub, looking at development and product development and implementation for Discovery. Deon, thank you very much for joining us today, and over to you.
Good morning, Gary, and good morning to your guests on the call, to the NMG consultants, and Gary, just to you and your team. Appreciate the opportunity to present this morning. Allow me just to get my presentation up quickly. And then without further ado, I'll get into it. As the topic of the morning is, of course, the updates for 2022. Just to echo Gary's comments, it's been another year of ups and downs for many of us. And it's with full appreciation of that we're presenting these updates to you this morning. Of course, Discovery's core purpose remains to make people healthier and enhance and protect their lives, and that includes you and the employees on Discovery Health Medical Scheme that you represent this morning. And it's really with great care for that core purpose that we present these updates to you. Of course, we live in a world which is changing as a result of COVID-19, and as we look to the future, given that we're presenting updates for next year to you, we have to consider sort of what are the emerging healthcare trends in a post-COVID world. Some of you may have seen some of these before, but for the benefit of those that have not, of course, we're living during a time when COVID-19 is having an unprecedented impact on healthcare systems around the world. South Africa not being excluded from that, and we're seeing what we're calling these utilization discontinuities, where we see periods of time when the use of the healthcare system is very different to what we're used to, seeing a reduction in medical admissions, but also a reduction in preventative care and screening. And this will have a profound impact on healthcare as we progress out of the pandemic and move into a world where COVID-19 becomes endemic to healthcare. Of course, COVID-19 has also brought about good change in the healthcare system, and in particular in the area of remote and digital healthcare, which has made healthcare more accessible, also more safe, and has amplified the healthcare that can be delivered to patients. And we've seen that globally, but also in South Africa, with healthcare now being delivered in unconventional settings as people try to avoid COVID and engage with the healthcare system in a digital and virtual way. COVID has also highlighted equitable and affordable access to healthcare as being critically important, and we've seen the impact that it has on the economy, but we've also seen what the impact can be on the economy of accelerating healthcare interventions, and particularly as we look at the impact that the COVID-19 vaccine rollout can have on the South African GDP. And then the fourth trend is that it's also accelerated the emphasis on population healthcare to improve the well-being of those living with chronic illnesses. Across the world, and I'm sure in your organizations, the issues that employees and people in general are dealing with from a mental health perspective are growing, and that's got an impact on their lives. It has an impact on their productivity, and ultimately, I guess, on the economy. And we also understand that chronic conditions in general, such as diabetes or heart conditions, accelerates the risk and enhances the risk of developing complications with COVID-19. So certainly, COVID-19 has shone a spotlight on the importance of managing population health. And then finally, we're also seeing as a general trend, and this has been even pre-COVID, disruptive players entering the market and disrupting healthcare where they enter. And we of course keep a close eye on these entrants into the healthcare system. Back to South Africa then, and I guess I'd be preaching to the converted if I say that South Africa's epidemic was pretty severe, and if we compare it to some of the other countries that experience of COVID-19, it certainly shows that South Africa has had it pretty bad. Unfortunately, a large proportion of the population has potentially been infected if we consider the data that's being published by the South African Medical Research Council. But more importantly, we can see that the epidemic certainly has had a significant impact on mortality in South Africa compared to say the impact on mortality in countries like the UK. So for that reason, Discovery remains completely supportive of the rollout of vaccines against COVID-19. And certainly if we look at the data that we've got available just within our own base, considering around 1 million people that have been vaccinated within Discovery Health Medical Scheme against COVID-19, it's clear what the impact of the vaccine has. It's clear what impact the vaccine has, with a reduction in the infection rate, reduction in admission rate, reduction in complications as a result of infections, and a reduction in mortality amongst the population within Discovery Health that's been vaccinated against COVID-19, and that remains a focus for us in the coming months to ensure that the momentum behind the vaccine rollout remains in place. Of course, during this period, this 18 months that we've been living with COVID-19, we continue to support our members, your employees, in various ways. We've been funding new healthcare claims related to COVID-19 since the onset of the pandemic, which includes the vaccination of members, testing of members, treating members for COVID-19. But of course, we've also continued to look after the non-COVID-19 healthcare needs of members, including looking after members living with chronic conditions or with a mental health condition, maternity, as well as active oncology treatment. Discovery Health Medical Scheme was also the only scheme at the end of 2020 to to use some of its reserves to assist members financially in terms of its contribution increase, and we announced a delay in the contribution increase for 2021 by 6 months. Effectively, that meant that your employees in Discovery Health Medical Scheme continued to pay 2020 contributions for the first 6 months of 2021, and only started paying their increased contribution from July onwards. That meant that they had a lower effective contribution increase for the year. And the scheme managed to do that because of the surplus that it built up as a result of the impact that COVID-19 had on healthcare claims. And the full value of that financial relief for members was worth around 2.2 billion rand. On the left-hand side of the slide here, we show the impact that it's had on the solvency levels of DHMS. So whereas in 2020, solvency went up to around 37%, of gross contributions, it's reduced in 2021 as a result of the strategy to use the reserves to reduce the impact of the contribution increase and delay the increase. And that's contrasted against the rest of open medical schemes who increased their contributions over who increased their solvency levels over the same period, given this contribution increase strategy that they employed for 2021. So as we look forward then to 2022 and looking at the impact that COVID-19 may have on the healthcare system and the use of the healthcare system by members of the medical scheme in 2022, we're already taking on a continuation of the strategy again. It remains a balancing act between keeping the scheme sustainable, but also ensuring that membership of the scheme remains affordable for your employees and for members of the scheme, in general. And that means that we have to balance the drivers of medical inflation, in other words, that increases the claims year on year, against the factors that are having a real impact on the affordability of medical scheme membership. So on the left-hand side, the long-term sustainability of the scheme and ensuring that the scheme's contributions keeps pace with medical inflation means that we have to increase contributions to allow for the fact that tariffs go up. That's the cost of the price of healthcare as it's charged by healthcare providers. The demographic risks, so that means that as people get older and sicker, in the medical scheme, they claim more and differently. We have to increase the contributions to allow for that. And then finally, for healthcare utilization as well, people using more of the healthcare system than they do in the past. And then on the other side, of course, we have to balance that against the very real impact that COVID-19 is having on the economy and the gradual recovery of our economy as we move into a world where COVID-19 is endemic. Out of all of those, the one that's most uncertain is utilization, because we've got these discontinuities. So a bit more on that. What we see, which is quite interesting, is if you consider the period 2020 and 2021, and specifically the second COVID wave and the third COVID wave, we see a spike in demand for healthcare services related to COVID-19 during the COVID waves. And that's demand for testing, and of course treatment of COVID-19. But that demand doesn't go away between the waves. So even between the waves, when we're seeing lower level of infections, we're still paying for testing, we're still paying for treatment, and we're still paying for vaccinations. So it's important to understand that the scheme effectively has a new line in its budget, which is labeled COVID-19 and having to pay for COVID-19. In addition to that, we also see a very different pattern of demand for non-COVID-19 healthcare services. And again, sort of contrasting what the experience is like during the waves as opposed to between the waves, we can see a severe drop in the demand for non-COVID-19 healthcare services here, represented by the demand for surgery. You can see a real drop in the demand for surgery during the second wave and again during the third wave. Well, in between the two waves, we see that demand for surgeries going up again, and in fact going up to levels above what we've seen, what we saw prior to COVID-19, as some of those surgeries are caught up then. And that's the same if you look at the bottom, experience that we see for major joint replacements, cataract procedures, and of course pathology claims. So we see a very different world in terms of the utilization of healthcare. And of course, what we have to kind of try to understand is, what would this look like in 2022? What would the waves look like, if there are, what the length of those waves are, and what the period in between those waves are. And that would inform kind of what sort of utilization we have to anticipate when we're pricing for medical inflation and in 2022 then. So that utilization can vary between sort of plus 0.5% to 2.5% because of that uncertainty. And it will really depend on the long-term health implications of any changes in the behavior of providers or systemic changes in healthcare utilization. It will also, of course, depend on the level of COVID-19 infections during 2022, the impact of long COVID. And then I guess also any long-term health effects of the COVID-19 pandemic, either as a result of the virus itself or as a result of people delaying healthcare, being diagnosed with cancer at a later stage, or catching up with procedures that they've delayed during this time because out of fear for COVID-19. This is consistent with what others are doing in the world. We saw that as US insurers are filing their regulatory pricing for 2022, that they're taking a similar approach to say that that they're anticipating that the impact of the COVID waves will be less severe during 2022. The periods between those waves will be longer, and hence you have to anticipate that healthcare will probably return to the same level, if not higher, during 2022 then. I also mentioned the impact that demographic risk has on medical inflation. This effectively means that I'm currently 44. Next year I'll be 45, unfortunately. But as one ages, the profile of your claims change as well. It is simply a fact that regardless of COVID-19, the membership of the scheme is still aging, and we're still seeing an increase in the number of chronic conditions that are registered for treatment on the medical scheme, and hence we have to allow for that in the pricing going forward, regardless of COVID-19. That is offset by growth still, and we still see that the Discovery Health Medical Scheme has a very healthy new joiner profile with a younger age and a lower chronic ratio than the existing membership base. But despite that, we're still pricing for an impact of demographic risk of about 3% over and above tariff increases, which will be in line with CPI of approximately 4.4% then. As I've mentioned, utilization remains very uncertain and certainly quite volatile, and for that, and with a range of between 0.5% and 2.5%. So we're estimating the impact of utilization on medical inflation to be around 1.5%. As in other years, we of course invest significantly in terms of reducing the impact of medical inflation, either through improving the demographic risk within the medical scheme or by managing the utilization of healthcare, and that combined impact reduces medical inflation by about 1%. So if you add those up, then you end up in a world where expected medical inflation for 2022 is 7.9%. And effectively what that means is, if you take the claims that you've experienced in 2021 and you have to project forward what you expect those claims to look like in 2022, you'd expect claims in 2022 to be around 7.9% higher. And at any other time, that would mean that you have to increase your contributions by 7.9% in order to ensure that you've collect sufficient contributions to pay for the expected claims in the following year then. Of course, I've presented now on these utilization discontinuities that we see, the fact that healthcare demand is different to what it's been in the past, and that you have these periods during the year when you don't see the same amount of claims as you would have seen in the past. That of course means that during those periods you're collecting more contributions than what you're paying out in claims, and that creates surplus that goes into the reserves of the scheme. And that's the impact that it had in 2020, was to increase the excess reserves of the scheme to around 37% of gross contribution income. The scheme then took the decision to take part of those reserves and use that to fund the deferral of the contribution increase to the value of around 2.2 billion rand, which ultimately was a 6-month deferral of the increase, which was supported by the Council for Medical Schemes then. And for 2022, we're taking a similar approach. So we're increasing contributions for 2022 by 7.9% to make sure that the scheme's contributions keep pace with medical inflation. But because the scheme still has excess reserves as a result of the utilization discontinuities, we're only increasing those contributions on the 1st of May next year, which means that your employees will continue to pay 2021 contributions for the first 4 months of 2022, at which point their contributions will then be increased by 7.9% then. And the value of that, again, is around sort of just over 2 billion rand in terms of the scheme's reserves that will be used to fund the difference between the 2021 and the 2022 contributions for the first 4 months of 2022. The strategy is really important because I guess the question could be why doesn't the scheme just increase the contributions by a lower amount at the beginning of the year rather than at a higher amount later in the year? So I have to contrast what this means for the scheme in the long term. So if we take an example on the left-hand side here where we're not matching medical inflation, in other words, claims are increasing at medical inflation, but you're increasing your contributions at a level below medical inflation. So the yellow line represents claims, the red line represents your contributions. Effectively, you've got a shortfall between your claims and your contributions. Now, one can argue that you have solvency, you have extra money in the bank, so you can fund that shortfall from the solvency. But that's only sufficient up until the point where your solvency drops below the regulated requirement of 25%. At that point, where you've effectively run out of excess reserves to fund the shortfall between your claims and your contributions, you have to, at that point, then adjust your contributions to the point where they match the claims that effectively that means you have to catch up for the years that you've lagged medical inflation. So if medical inflation was 8% and the scheme continued with increases, say at 5%, at some point they're going to have to make that 3% up, which could lead to double-digit increases at some point in the future. Then you can contrast that with a different strategy, which is then to say, well, keep the two matched. So you take your contributions, you make sure that they remain matched to your to medical inflation. But then the question is, well, you've got these excess reserves. What do you do with those then? And this is the strategy of DHMS then, is to use those reserves to delay the onset of the increase. Effectively, the scheme pays the difference between the required contribution and the actual contribution for the first part of the year, effectively done by delaying the increase. And that means that the scheme remains matched, the contributions remains matched to expected claims in the future. And you don't need to make that sort of price adjustment at some point in the future because you've remained matched then. But you don't have to use you're not running off your solvency in the process either. So it's really coming back to this balancing act between making sure that the scheme remains sustainable, but at the same time also recognizing that there's excess reserves that can be used to provide financial relief to members, and that contrasts the Discovery Health Medical Scheme strategy against that of other open medical schemes being followed currently. Of course, the contribution increase simply reflects the increase in the contributions year on year. It doesn't reflect the actual affordability of the contributions. The affordability of the contributions is obviously a comparison of rand amounts. If we then look at sort of historic increases for Discovery Health Medical Scheme, those have historically been in that sort of range of CPI plus 3 to 4%. And in the last year, it's been above that of our competitors, whereas in previous years, it's always been below that of competitors. The net effect of sort of the sustained lower contribution increases over time for Discovery Health Medical Scheme means that, on average, Discovery Health Medical Scheme contributions are around 12.2% lower than that of the next 6 largest open schemes. And despite the higher increase in the most recent round of increases, that remains captured, this pricing advantage that we have over open medical schemes and the affordability that offers to your employees. Of course, contributions are only one side of the equation here. We also have to look at sort of the benefits. So it's of course, we have to make sure that benefits are also increased year on year to make sure that the real value of those benefits remain preserved for your employees, and that the value proposition of the medical scheme remains relevant. So we've made certain sort of targeted benefit enhancements to the benefits for 2022 in the areas of assisted reproductive therapy, in the area of allied therapeutic and psychologic treatment, palliative care, and also precision medicine for oncology. There's been some targeted benefit enhancements. We also looked at specifically 2 areas of trauma, and in those areas we've enhanced the benefits and the availability of those benefits for members and their families post a traumatic event, and also in the instance where it requires basic dentistry, the replacement of teeth as a result of an accident or injury, and there's been some enhancements to the benefits there. And then we've also enhanced the benefits around the management of chronic illness, and I'll talk a bit later also about some exciting initiatives that Discovery Health, the administrator of Discovery Health Medical Scheme, is introducing for 2022 to assist members in the management of their chronic illnesses. So effectively then, to summarize, the Discovery Health Medical Scheme's contribution increase will be 7.9% effective on the 1st of May 2022, and your employees will continue to pay that the 2021 contributions for the first 4 months of 2022. If you take the analyzed contributions for 2021 and you calculate what the effective contribution increase is, it's about 5.3% for 2022. In fact, if you take it over the entire period so far of the pandemics, so in other words, the increases that we've had for 2021 and then the anticipated increases for 2022, the effective increase over the 2 years is around 5.6% per annum to the contributions then. And at the same time, then we've also made these enhancements to benefits across the plan ranges, some specific to some of the plans, others applicable across all the plans. Importantly, those benefit enhancements and the adjustments to the benefits are effective from the 1st of January and won't be delayed until the 1st of May. So your employees will have the benefit of the enhanced benefits from the 1st of January, even though they only start paying the increased contributions from the 1st of May. Moving on to some enhancements that Discovery Health has made to enhance access to healthcare and the quality of the healthcare that your employees have access to through the Discovery Health Medical Scheme. It's really based around the accelerated digitization of the healthcare system, and in particular how we've seen COVID-19 accelerate the delivery of hospital level care in patients' homes. So rather than being admitted into an acute ward of a hospital on presentation of certain symptoms, the patient is being admitted to hospital in the comfort of their home and being looked after in their home. We've already done this now for a few months, particularly during the 3rd wave of COVID-19. We admitted 100 people, members of the scheme, to their homes for treatment. At one point in time, we were looking after 10 people. Each one of them were in hospital, in inverted commas, for about 5.5 days, and we monitored their vitals remotely in partnership with Bioformos and BioBeat, which gave us 24/7 access to important clinical measures such as an ECG, pulse rate, respiratory rate, blood pressure, temperature, oxygen saturation. And those were linked to a command center, which then could initiate interventions in person by either qualified nurses or the doctors or the doctor treating the patient to make sure that they to make sure that those interventions are delivered at the level of care that they would otherwise receive in a hospital then. And based on this experience of looking after patients in COVID-19, we're now making it available in 2022 across a range of acute conditions that are appropriate for being cared for at home, with clinical oversight from a care team, 24/7 real-time remote monitoring, and hospital-level diagnostics and interventions delivered in the comfort of a member's home. We've also looked at, based on the trend of population health and the importance of population health, how people are looking after their chronic illnesses. And one thing that's really interesting is that, of course, those living with a chronic illness are seeing their doctor on a regular basis, and they're looking for information from their doctor on how to manage their condition. But in between those clinical touch points, they're also using online searches, medical websites, advice from family and friends, and even social media to inform them on how to treat their condition or manage their condition. And this is not saying that information is necessarily wrong, but it can create conflicting clinical guidance and unfortunately lead to suboptimal outcomes in the management of that patient's condition. If you take an alternative approach, which is to say, let's connect patients with other patients living with the same illness, allow them to connect digitally, share their sort of real world healthcare experiences, share their own experience in terms of managing their illness, and then moderating those conversations with experts in that particular clinical condition. You get a much better moderated conversation around the management of the person's condition. So for 2022, we're introducing a partnership with MyHealth teams to look after patients living with diabetes, to look after patients living with heart disease. This will give them a social platform where they can connect with patients like them, share their real-world healthcare experiences, share their treatment regimes, and have those moderated by clinicians to ensure that it doesn't create conflicting clinical guidance or suboptimal outcomes. And together with MyHealth teams, we're also developing a program specifically aimed at long COVID. As we see the emergence of long COVID, effectively people presenting with COVID-like symptoms long after they've been diagnosed with it. And of course, also understanding that those that have been hospitalized for COVID have a higher risk of developing diabetes or a cardiac condition post-diagnosis with COVID. And we're really excited for your employees to have access to these 3 digital patient communities powered by MyHealth teams from 2022 in the areas of diabetes, heart disease, and long COVID. For many of you on the call, I think a large proportion of your time over the last 18 months have been taken up by what's been changing from a workplace perspective. Certainly we at Discovery have been grappling with the same thing, changing working environment, the increasing need to manage the health and wellness of employees, and to address this need for equitable access to healthcare. As we've seen sort of our workforce shift to a hybrid workforce, some working from home, some working from the office, and some sort of commuting in between the two of them. Certainly amongst our colleagues, we've seen an increase in the prevalence of financial and emotional well-being issues as a result of the impact on COVID-19, perhaps not on the employee, but perhaps within their family or their greater family then. So we've looked at sort of the assets that we have available and the products that we make available to you as employers, and enhance those to specifically address these particular challenges. The first one is within Healthy Company. So this is Discovery's employee assistance program, and we've updated the app that is available to employees through Healthy Company with a whole suite of online well-being assessments and a completely updated interface to make access to those well-being assessments completely seamless. And then we've also activated Vitality Active Rewards for employees to incentivize their engagement with Healthy Company then. Of course, the importance of this digital well-being assessments is really important, because we see, as if we look at sort of our Healthy Company clients, 91% reduction in the wellness screens being done by those employers post COVID-19. Of course, the great concern there is we simply don't know whether an employee is doing well from a physical health perspective, a mental health perspective, or a financial health perspective. And therefore, giving them access to enhanced digital well-being assessments is really important, and even more important, making sure that the correct interventions are presented to them to make sure that they can manage whatever risks they're presenting with. And then to incentivize them to engage with the program, we've introduced Vitality Active Rewards for employees into Healthy Company. This means that any employee on Healthy Company will get access to the exercise ring in Vitality Active Rewards. and they don't need to be a member of Vitality in order to access that. Effectively, the exercise ring in Active Rewards is a simple weekly goal of a level of physical activity that the employee has to achieve, and that goal is adjusted to make sure that there's habit formation in terms of continuously engaging with physical activity, and allows a person also to earn rewards for hitting those goals. Of course, we have to track the exercise and we have to track the physical activity. So in 2022, we're also making available a subscription benefit for wearable fitness devices. It's a flexible month-to-month subscription available on a range of wearable devices: Huawei, Fitbit, Apple, and Garmin devices. The employee can take out a subscription for one of these devices and effectively own the device after 24 months, or return the device at any time with 1 month's notice without any penalties. And then we're also introducing dynamic healthy company goals, which will allow you as an employer to configure particular goals that you want your employees to achieve in a particular period of time. And your employees will be rewarded with Discovery Miles for hitting those goals. And this can be based on physical, emotional, or financial well-being. So really enhance the healthy company product to address those two areas of a changing working environment and also the need to look after the health and wellness of employees. And then to address the equity or inequitable access to healthcare, last year we introduced Discovery Prepaid Health, which is effectively just that. It means that you can purchase vouchers for healthcare at below market rates, and that today includes physical or virtual consultations with a GP, including the medicine that the GP may dispense at the point of consultation. Then, and that's already available. That's already available to anybody in South Africa. We've enhanced the employer zone to make it possible for you as the employer to purchase these vouchers on behalf of your employees. It's a really simple and intuitive purchase process, and a very simple process for you to store those vouchers and distribute them to eligible employees. And this will be available during 2022 to view and select the voucher types, make a payment, and then distribute it to the eligible employees as you see fit. It really is up to you as to how you use this particular platform to make healthcare available, private healthcare available to those employees that may not have access to insurance. We've also looked at ways to enhance the value that Discovery Health Medical Scheme members have from the rest of the Discovery group. Of course, Vitality already enhances quite a bit of the value, especially for healthy living. Given that you're not claiming from the medical scheme, you get value back from Vitality in the form of lifestyle rewards for being healthy. And for 2022, we focused on adding to that integrated value from Discovery Bank, which is as good at monetizing behavior as Vitality is, but also obviously works in the world of assisting with payments. And we've done that by creating a Discovery Pay account. It's free to activate for any member of Discovery Health Medical Scheme, and it comes with the Vitality Money, which is Discovery Bank's Vitality program, dynamic interest rates, and the ability to earn and spend Discovery Miles, but also two exciting additions to that in the form of Vitality Travel and Discovery Pay. Discovery Pay allows an employee to have a seamless experience in terms of paying for healthcare at pharmacies around South Africa, hospitals and laboratories, as well as GPs. And that's really in the instance where the employee perhaps doesn't have benefits for that particular healthcare service, or have run out of benefits for that particular healthcare service. I'll give you an example. I had to get a new pair of glasses this year, and that, with some other healthcare expenses, meant that we ran out of our savings about a month ago. I had a script for medicine which I had to collect a week ago, and normally, if you run out of MSA in the pharmacy, you would then have to collect your medicine in the little cage, take it to the front of the pharmacy, and then pay for it before you leave the pharmacy. With this integration that we now have between Discovery Bank and Discovery Health Medical Scheme, the claim effectively also looks whether you've activated Discovery Pay, and if you have activated Discovery Pay, it'll pay that claim up to an amount that you've specified from your bank account then, which meant that for that medicine, despite me having run out of MSA, I simply walked out of the pharmacy with the medicine, and I received a notification to say that I've just paid for Discovery Bank has just paid for the medicine, and we're extending that capability to GP practices, and it's already available in hospitals and pathology labs. We're also expanding it into our Vitality network to make pay-as-you-go gym available to members of Discovery Health Medical Scheme. So through this Discovery Pay account, you would be able to access Virgin Active gyms and Planet Fitness gyms on a pay-as-you-go basis from as little as 75 Rand per visit, including some three free visits per partner once you've activated Discovery Pay. Discovery Pay also comes with Vitality Travel, which is a travel booking platform that we've built into the Discovery Bank app. And any bookings by a Discovery Health Medical Scheme member that has activated Discovery Pay attracts a 10% discount on local flights, international flights, car hire, accommodation, and travel packages. If we consider then sort of the changes to Discovery Health Medical Scheme, including the contribution increase, the changes to the benefits, the addition of healthcare services, and the integrated value, your employees remain in an environment where they're getting exceptional value from the membership of their medical scheme. Through the sustainability, in other words, the scheme reserve position remains healthy, and its contributions are still matching medical inflation. Continued affordability through this pricing advantage that we've built up over time through lower contribution increases. The flexibility to choose from 23 plans, in particular considering new employees joining and wanting that sort of flexibility between based on healthcare or financial needs. Continued enhancement of benefits to ensure that benefit design and access to healthcare remains relevant, and then also the integrated value delivered through Vitality and Discovery Bank. Turning to Discovery Vitality then, Vitality's role has never been more important in my view than during COVID-19. COVID-19 has demonstrated simply just how powerful the impact of Vitality has been. We know that COVID-19 has a significant impact on mortality risk at all ages, ranging between 2 times to 10 times an elevated mortality risk as a result of a COVID-19 infection. But when we compare that to what happens at post-vaccination, that's substantially reduced. In fact, vaccination returns you almost to base mortality. And for that reason, we made the announcement a few weeks ago that any member of Vitality that's been fully vaccinated in 2021 will receive 2,500 Vitality points to count towards their status during 2021. At the same time, also, we know that COVID-19 is the impact of COVID-19 is highly dependent on the health of the individual, and the health of the individual is obviously dependent on their healthy behaviors. If we then look at sort of what impact COVID-19 has had on the health of people globally, we know that exercise levels have reduced, diet has deteriorated, and screening levels for health conditions have reduced. But that's not the case amongst the Vitality members. Vitality members have kept up, in fact, increased their exercise levels. They've improved their diets, and they've increased their screening levels relative to the period prior to COVID-19, showcasing us just how important Vitality is to keep a person engaged in a healthy lifestyle and maintaining that health for the benefit of their mortality and their morbidity. So, of course, it remains important to ensure that your employees that have access to Vitality have an enhanced experience in 2022, and that it becomes affordable for them to also join Vitality. So we've looked at a number of adjustments and enhancements to the Vitality program. I've already mentioned Vitality Travel, the travel platform that's now available through Discovery Bank and available to Discovery Health Medical Scheme members that activate that through Discovery Pay. It's also available to Vitality members, of course, through Discovery Pay. And Vitality Travel has been enhanced to now include a range of partners, including Airlink, Fly, Safair, and Lyft, now give you access to more than 40 regional destinations in South Africa and immediately bordering countries, with a discount of up to 35% for Vitality members, going up to 75% for those that are on Discovery Bank. That extends to international flights, with up to 75% off two bookings per year through British Airways, Emirates, or Qantas. 35% through the Vitality program, and up to 75% through Discovery Bank. We've also increased the range of accommodation that can be booked. Now includes Protea, Hotel Sun International, and Tsogo Sun, with up to 25% discount. And for next year, we're also including holiday packages through World Leisure Holidays, Beachcomber, Contiki, Royal Caribbean, and Globus, with a 15% discount off the retail rate of holiday packages available to Vitality members. So it really becomes the widest and most valuable travel platform in South Africa for Discovery clients, from a flights perspective, accommodation perspective, and in general a travel perspective. We've also updated the digital experience, as we've done for Discovery Health. We've also updated the digital experience for Vitality members, and in particular also from an onboarding perspective, those that join for the very first time, to make it very simple for them to do that first set of assessments and to understand what to do next, and also how to be serviced digitally, especially for those of your employees that are au fait with using digital service channels. For young families, we've enhanced the incentives available through Healthy Baby, where you can now get up to 50% back on an extended range of baby essentials, which will in 2022 will include Baby City. From a smoking cessation perspective, we've partnered with arguably the world's most effective tobacco cessation program called Quit Genius. And a Vitality member that wants to quit smoking can get 80% off a 12-month subscription to Quit Genius, valued at about 3,750 Rand. Quit Genius is brilliant. It's got a 52% validated tobacco quit rate. It uses a combination of cognitive behavioral therapy, what they call quit coaches, tracking tools, and nicotine replacement therapy to assist a member in terms of quitting smoking. And then finally, we've also looked at Vitality Active. Vitality Active is a more affordable version of Vitality, and we've enhanced that program substantially for 2022. The price of Vitality Active in 2022 will be 99 Rand for an individual member, and each beneficiary is added at an extra cost of 59 Rand. It's based on the same principles of the Vitality program, which is to know your health, improve your health, and get rewarded. So the same battery of screening and prevention tests, and rewards delivered through Vitality Active rewards, movies, and integration benefits with the other Discovery products. In terms of helping members on Vitality Active improve their health, we include the pay as you gym benefits. So this is the ability to gym at Virgin Active or Planet Fitness gyms without a subscription and paying per visit from as little as 75 Rand, including introducing healthy food into Vitality Active. So a person can get up to 20% off their healthy food purchases at Pick n Pay and Woolworths, and bearing in mind that that's for 99 Rand a month contribution. And they also get a wearable fitness. They can also subscribe to a wearable fitness device. So this is a fitness device from a catalog that includes Apple and Garmin. You subscribe to the fitness device payment for 24 months. And at the end of the 24 months, you own the device. You can return it at any point in time. But if you use the device to be physically active, you can earn back the subscription. And that would require you hitting 3 or more of your goals during the month to have a 0 subscription payment in that particular month. So then, to summarize Vitality's updates for 2022, Vitality members get access to an enhanced travel platform, an enhanced digital experience, enhanced Healthy Baby program, the smoking cessation program with Quit Genius, and an enhanced Vitality Active. And during this year-end period, we'll allow members that join Vitality for the first time to join Vitality free for 3 months. And they can also join a Virgin Active gym or a Planet Fitness gym free for the balance of 2021. So in other words, they pay no gym fees, and they pay no activation fee through Vitality for the balance of 2021, and their subscription fees will only kick in after that. With that, I'm going to hand back to Gary, and I'll be happy to take some questions in terms of the updates to Vitality and Discovery for 2022.
Thanks very much, Dion. At the moment, there are only one or two questions which I'll pose to you. And basically, the first question is, Dion, will we be allowed to change options in May, considering that the contributions will be going up in May?
Gary, yes. So similar to the process that we had, during 2021, we'll allow members to upgrade their plans on the 1st of May, should that be required then.
Perfect, thank you. And then another question is just around the key care income bands. What happens to that going to 2022?
So the key care income bands will be adjusted. The thresholds are increasing by 4.5%, so in line with the consumer price inflation. And that'll be effective from the 1st of January.
All right. Yeah, I think those are the questions that came through, Dion. Thank you very much for a very comprehensive update. And I think, just for the clients out there, a lot of this information is quite detailed, and we are making a recording of this presentation, so we will make that available to you via your consultant. And also the consultants will then be sharing more information with you and your staff members in the next 6 to 8 weeks. Thanks very much for your time, Dion, and much appreciated.
It's a pleasure, Gary, and thanks again for the opportunity. Thanks for your support, and also to the clients that joined the call. I wish you best for the balance of the year.
Right, ladies and gentlemen, so we'll carry on with our agenda. So without any further ado, just as far as the industry's update is concerned, I think it's important for people to realize what's happening in the healthcare industry. And this slide looks at the number of medical schemes over the past 10 years, and we can see there's a continuous decline in the number of medical schemes. On the far left-hand side, the dark numbers reflect the open medical schemes which you and I can join. The red columns in the middle are your restricted medical schemes, and then the yellow columns are the total number of medical schemes in South Africa. And you can see there from 2010, basically 11 years ago, the number of total medical schemes is reduced from just over 100 to 76. And that trend is an ongoing trend, and the latest amalgamation we've seen announced last week was the amalgamation between Sizwe and Hosmed. So the open medical schemes are reducing. And then you can look at the market share between Discovery, which is the largest open medical scheme, and GEMS, the government employee medical scheme, which is the largest restricted medical scheme. Between the two of them, they have just over 50% of the market as far as members belonging to medical schemes in South Africa. So just give you a bit of an idea of what's happening in the medical scheme environment. And then I think also important, if we look at those open medical schemes, the 10 largest open medical schemes cover 92% of the members that are covered on open medical schemes. That means that the other 8 only cover 8%, which just once again highlights the size of these medical schemes. Now, the information around this we will share with you, and some of you might have seen the more detailed report already. It's one of the reports that we are sharing with our corporate clients at the moment, is our scheme review. The Council of Medical Schemes has just released their latest report, which we then analyze and share some of that information with you. So that just gives you an idea of what's happening in the medical scheme environment. The other point is then to look at the industry update as far as medical scheme increases are concerned. And Dion has focused quite extensively on the Discovery medical scheme and the rationale behind that increase put through for 2022. So if we look at what's happened and what was announced in the last couple of weeks in the industry, from the left-hand side, you can see there MedShield announced a 6.3% increase effective 1 January. Bonitas announced a 4.8% effective 1 January. Bestmed 3.9% effective 1 January. Then we had Momentum, who followed Discovery's way of doing it, and then have delayed the announcement, and they've delayed the announcement to September, an increase of 6%. FedHealth have also delayed their announcement to April, and an increase of 5.5%. The only one that medical scheme that came through with a reduction going to 2022 was MediHelp, and their average contributions decreased. There were a couple of the options that still had a slight increase, but the average contribution was a decrease of 0.5%. As we've just heard, Discovery's increase of 7.9 is effective the 1st of May, and Sizwe has announced an increase effective 1 January of 7.6%. So that gives you an idea of the increases going into 2022. What I then did was I just wanted to give you an idea of what's happened over the past 5 years, because a lot of people are saying, are these increases above normal, below normal, or are they the average? So I took basically the 6 largest medical schemes, and I looked at the increases year on year from 2018 through to 2022. And you'll see there that, and we always talk about the corridor of certainty, that it's traditionally CPI plus approximately 3% on average. Yes, we've seen there 2021 and 2022 slightly lower, and that, as Dion also explained, is some schemes have decided to use some of the reserving. We've seen solvency levels have gone up on all medical schemes due to COVID. That's a result of the cost of planned procedures dropping dramatically over the last 18 months. So that just shows you the average per medical scheme per year over the last 5 years. So that's an overview of the medical scheme environment. And I think Dion touched on it as well. Challenges facing South Africans, not only employers, but South Africans at large. It's basically the physical well-being, the emotional well-being, and the financial well-being. Now, ladies and gentlemen, I think I don't have to go into this slide in much more detail. We have seen on the claims histories where a lot more people are struggling with anxiety, depression, and ultimately, as you can see there, by 2030, depression will be the world's leading burden of disease. So anxiety has basically been escalated dramatically over the last 18 months due to the COVID pandemic. And ultimately, what I'm trying to point out here is the importance of an employee assistance program. Please engage with your consultant. We do have access to a number of different employee assistance programs, and we are there to assist you to identify the most suitable program for you and your staff to ensure that your company is looking after its employees. The next slide I also wanted to just share with you around the industry. I think challenges facing South African employers. Does your organization look something like this, that only your top management or up to middle management have got healthcare cover and the workers are standing outside? I think the solution that we've identified that has worked very well for a large number of our organized companies that we consult to is the primary care. A primary care cover is better than no cover, and it also releases the burden of your staff members having to make use of public facilities, specifically around day-to-day medication, where they need to take a day off to go and pick up their monthly chronic medication. That can be facilitated and expedited by becoming members of a primary care product and accessing that from a private facility. So once again, we are there to assist you looking at these solutions independently, doing a review for you and your organization, making sure that we identify the most suitable, cost-effective product for you. So that is it from my side for the time being. I will be back after we've listened to some of these exciting tools. I'm very excited about these tools and programs. And I'm now going to introduce Gary Scott to you. Gary Scott is one of our senior healthcare actuaries, and him and his team have spent the last couple of months looking at this benefit diagnostic tool, which I believe is going to add huge amount of value to you as an organization and for us to assist you to identify the suitable solutions to make the most of the spend that you are investing in your staff. Gary, thank you very much for your time, and I'm now over to you.
Thanks, Gary. We aim to confuse you with all the Garys, I guess. I'm going to share my screen if that's okay.
Perfect. Go ahead, Gary.
Let me know when you can see it.
It's there. Just put it on slideshow.
Perfect. Yes, as the other Gary was saying, it's a great pleasure to introduce this benefit diagnostic tool that we've been building within the consultants and actuaries team. It's a web-based tool, and it enables employers to measure the effectiveness and extent of their health and wellness programs. And I don't need to tell this audience that, health and wellness benefit strategy can boost employee morale, boost productivity, reduce absenteeism, and reduce staff turnover. It's probably one of the key programs to get right in your organization. The diagnostic tool is actually made up of 3 parts. We've included clearly the health and wellness component. That's of interest to this audience. But also there's a remuneration and engagement section and a retirement and insurance section. And we want to encourage you, once you've explored the tool and are comfortable that you've explored all of the health and wellness aspects of your organization, to pass it on to colleagues so that they can look at it from these other two aspects. Our intention is to get the tool, as widely and as broadly used as possible. We've tried to keep the user interface as clean, as simple as possible. The sign up and creating logins is very straightforward, and there's no limit on the number of assessments you can run or the number of logins you can create. Our objective is really to get as many organizations loading their information onto the web app. And the more information we get loaded, the more organizations that we're able to attract, the richer the benchmarks become. And our intent as we go forward is to start looking at the benchmarks at an industry level, at a company size level, and the more granular the benchmarks become, the richer it is for the participants. So we're trying to create a virtual circle in this regard. So the health and wellness assessment consists of 27 questions. We've tried to keep them short but relevant. And the questions cover 6 dimensions of your health policy, the medical aid cover you provide to staff, any post-retirement subsidy you're providing, gap cover, primary care, and wellness. You'll get a diagnostic report once you've completed these questions, and the diagnostic report will be reflected visually as it is in the slide as the sort of blue shaded area. And you'll have sort of 6 scores, as I said, reflected in this spider graph. You'll also have the ability to compare your organization with the benchmark. The benchmark at the moment is created by the NMG universe. So we've loaded the NMG client data onto it to generate these benchmarks. And as I said, as we get more and more information and more organizations, we'll get more and more granular with the benchmarks. What this spider graph is showing you is that this organization scored very highly on primary care, better than the median performance of the NMG universe, but is slightly lagged on health policy. Now, some of the value add that the NMG consultants will be adding will be to try and unpack any gaps in your scores, to try and understand why the gap is there, whether you're comfortable with the gap, or what you'd need to do to close the gap. And that's really where the gold dust will sit in using this diagnostic tool. We've tried to keep the tool as complete as possible, so you'll be able to run it on your own, independently of your interaction with your NMG consultant. You'll be able to download, get a score for your organization, so you can see where you stack up against the universe. Download a report. It'll be a PDF report that gives you the score, both graphically, and unpacks that score at each dimension level. You'll be able to rerun the assessment if you want to try and explore on your own why you fell short in a certain dimension. You go and revisit those questions, maybe do what ifs. What if I answered this differently? How would it change my score? And you'll be able to run assessments on a periodic basis. So if you wanted to run assessment each year, in the app, your old assessments, your history of assessments will be kept. So the idea here is if you do discover gaps that you want to close, you'll be able to see how your performance compares, with the universe on a periodic basis. Just leaves me to say thank you for your time, and we've, certainly enjoyed building the app, and we look forward to feedback. You should be contacted by one of the energy consultants over the next few weeks, please look out for that. And as I said, your feedback would be appreciated. Gary, should I keep my screen open while you take questions, or are you happy that I stop sharing?
You can stop sharing, Gary. I'm going to just share for 1 minute and then I'm going to introduce Scott. But are there any questions? I haven't seen anything specific coming through for Gary. But yeah, as I said, I'm hugely excited about this tool. I have had the opportunity to look at it a couple of times and to calibrate it with Gary and the team. And I think it's going to add a huge amount of value, not only in the healthcare space, but in the remuneration and retirement funding space as well, which I know many of you are involved in as well. Gary, thanks very much. If there are any questions that come through post your session, I will revert to you and we will answer to the people via email.
Thanks, Gary.
All right. Yeah. So yeah, I think the benefit diagnostic tool is more focused on the corporate and on the company and how we can assist you to make the most of your spend in the healthcare space, and then, as Gary also quite rightly said, in the retirement fund space. The next two are more focused on the member level, and I've asked Scott Harvey, who heads up our growth and membership team in NMG, to share the information with us. I think once again some exciting developments and some innovation that has taken place over the last couple of months during the quieter COVID time. Thanks, Scott. Over to you.
Thanks, Gary. Good afternoon, everyone. I'm just going to spend a couple of minutes giving you an overview of two new NMG benefit member solution initiatives, as Gary said, that we're very excited about. The first of these is what we've called Smart Aid, and our financial needs in retirement are unique, really, for each of us. But no matter who we are, our financial needs in retirement can be split into two buckets: essential expenses and non-essential expenses. Essential expenses cover the basic survival necessities of food, shelter, medical care, although I think in this day and age many would classify Wi-Fi as an essential expense. So that is really the income that you require in retirement to survive. Non-essential expenses are those things that we want but are not absolutely crucial for survival. Nice shopping experiences, holidays, etc. Zooming in onto the medical expenses in retirement, we know that retirees are under increasing pressure to afford their medical costs in retirement, which is exacerbated by the relatively poor state of the public health system. And really, there are four primary reasons why retirees are feeling that pressure. The first one is that whilst medical aid premiums are community rated, older people want and generally need richer, more expensive benefit options. The second reason is that premiums, as Gary mentioned, generally increase in that corridor of around 3% above inflation every year. The fourth reason is that in this modern age, very few employers are still offering medical aid subsidies for their retirees. That is a defined benefit option which seems to have been phased out over the last decade or so. And then finally, most South Africans are unfortunately not saving adequately for retirement. So what we're painting a picture of there is that medical aid premiums are an essential expense in retirement, but retirees feeling increasing pressure for those four primary reasons to fund that expense in retirement. But importantly, medical aid premiums are an essential expense that can be budgeted and saved for with a very high degree of certainty. That's caused us to develop what we've called Smart Aid, which quite simply is a retirement savings pot that is dedicated to the essential expense of medical aid in retirement. Smart Aid is a retirement annuity, which comes with all the usual benefits like tax deductibility of contributions, portability, contribution flexibility, etc. However, it takes each member's actual circumstances into account to determine whether or not they're on track to meet their specific medical aid premium costs in retirement. And it does this via a projection tool. So I've loaded an example here of a 35-year-old female who's planning to retire at the age of 65. She's on Discovery and she would like to retire into a classic priority plan. She has a spouse and her current medical aid premium is around 6,800 Rand a month. She would like to target 100% of her medical aid premium in retirement. Current savings that she's allocated to medical aid premiums of around 700,000 Rand, and she's currently saving 2,000 Rand a month for her medical premiums. There's no investment choice in the Smart Aid retirement annuity. There are simply two underlying investment strategies that are growth equity type assets and then fixed interest assets. And members' underlying individual investment strategies are adjusted automatically each year based on whether they're on track to fund their desired percentage of their medical aid premiums in retirement. In terms of this client's example, the projections are showing in the grey bar on the left-hand side that medical aid premium in 30 years' time will be just over 48,000 Rand per annum, whereas her savings will cover about 44,000 Rand of that per month. That means that she's going to have a shortfall of around 4,300 Rand per month. The tool then allows her to adjust those inputs to say, well, am I going to reduce my medical aid plan that I'm targeting? Am I going to increase my savings? What levers am I going to pull to make sure that I can fund 100% of my medical aid premiums in retirement? Each member will receive a personalized annual statement showing them whether they're on track to meet their goal or not. And importantly, the focus is on the goal rather than the investment return. This is a discrete pot of retirement savings that is 100% focused on medical aid premiums in retirement, and we're interested on achieving that goal rather than analyzing an annual or a quarterly investment return. Of course, the investment return is important, but the primary focus is the goal. If the member is not on track, they will then be able to determine what action to take using their annual personalized statement and the projection tool. So very quickly, that was a whiz around the Smart Aid product, which we will be bringing to you in the not too distant future. The second NMG Benefits Member Solution initiative that we'd like to share with you today is Smart Alec. We're going to show you a short Smart Alec video, but before we do this, just a couple of introductory points. Smart Alec is a two-way conversation-based financial literacy tool on WhatsApp. We think it's incredibly simple, engaging, and easy to use, along with being cost-effective and measurable results for you as the employer. Also, just as important is that it's tailored for the South African environment. And finally, it's exclusive for educational use only. There is no call to action or sales angle. It is purely a financial literacy education tool. So Gary, as promised, I've kept that really short and sweet, and I'll hand back over to you to play the video for us. Thank you.
Being financially knowledgeable is the foundation upon which future plans can be drawn up and achieved, resulting in the ability to live the life you want to live and not the one you have to live. Now, how do you make the right decisions if you do not understand all the financial products and the big words that come with them? Hello Smart Alec, a user-friendly financial education platform that uses chat messages to teach you about various financial tools through WhatsApp. Smart Alec uses simple, clear language that is personal, easy to understand and remember. It's like chatting to a friend whilst learning at the same time. Smart Alec is designed for people in Africa and is open to anyone who has WhatsApp. To get started, just save the number +27 71 455 2782 or scan the QR code with your WhatsApp camera and say hi. Type in your unique access code. Choose a course you want to learn. Select your preferred language. English, isiZulu, or isiXhosa. Select your province, and then pick a character that you are drawn to and learn through their personal experience. With Smart Alec, you can access and educate yourself on banking, budgeting and payments, loans, interest and credit bureaus, investing, retirement funds, insurance and healthcare, scams, pyramid schemes, and more. You will be given bite-sized explanations and ask simple finance-related questions, And as you continue to answer, you will master new and relevant financial terms that will expand your understanding of how the world of finance works. Got distracted? No problem. Smart Alec gives you the option to pause and continue whenever you have free time. And in case you forget to return, it'll give you a little reminder to get you back on course. And when you finish each course, you will get a certificate. It's easy, personalized, and just like chatting to a friend on WhatsApp. Try it now by scanning this QR code with your WhatsApp camera and using the code NMG. Terms and conditions apply. The NMG South African group of companies are authorized financial service providers. For more information, contact us via email smartalec@nmg.co.za. NMG Smart Alec, powered by FinEasy, finding a better way.
Thank you, Scott. Yeah, thanks very much. I think in conclusion, I've just got 2 more slides and then we can call it a day unless there are more questions. But I think ultimately, I just wanted to conclude the session today and just share the year-end renewal plan and procedures as we traditionally do. I think as we've seen today that the medical schemes have all launched, and we will start from the 18th of October with presentations and one-on-one consultations at your employer sites. Your consultants will engage with you to plan face-to-face, virtual. We will be doing webinars as well. Option changes going to 2022 will be done by December the 10th. Option changes are effective the 1st of January. As we know, specifically on Discovery, you will be able to change your option again 1 May once the increase goes through. And then we will do consultations if necessary in March again. There are different support materials that will be made available to you and to your members. We will be drafting letters. There will be webinars either at the employer site, or we will be hosting national webinars as well. We will also be making available videos to you that you'll be able to distribute to your staff that they could either watch in their own time, share it with their families, etc. And then also, very important for your executive team, we are also making available one-on-one sessions that our consultants will be available to you to meet with your execs, going through their needs and making sure that they are on the right option and are comprehensively covered according to their needs. Ladies and gentlemen, on behalf of the NMG executive, I'd like to thank you for your time, and we don't take our relationship for granted. We are there to support you and specifically your staff, making the most of their healthcare spend and ensuring that they've got the correct cover going forward. I also just wanted to remind you that you will be receiving an email from us post this session, which you'll be asked to put an address in. We have secured a little gift for each one of you attending today's session, and you'll have a choice of a gift. If you can respond to that email with a delivery address in, and we'll arrange for those gifts to be delivered to you in due course. Thanks once again for your time today. All the best for the last quarter of 2021. And for those of you who are taking a break at the end of the year, stay safe, and hopefully we'll be able to see you face to face quite soon. Thanks for your time, and goodbye to everybody.